What is the biggest misunderstanding people have about cancer?
So that is the biggest myth. No, not every cancer is fatal. And with the recent advances in the treatment and medication of the cancer, there is so much life after the diagnosis of cancer.
If you don't have cancer in my family, can I be free? That is the most top question that I found on internet.
So if there is no family history, definitely you are at lower risk than other individuals who have the family history. But other factors like environment, your lifestyle, your food, your habits, they all play very major role rather than just a family history.
How can someone support a friend or a family member with cancer without saying the wrong thing?
Give your support your way to encourage the patient rather than just saying कि भाई થઈ જશે અને સારું જ છે. That is a pity. Don't do that.
A quick quiz. Which habit increases risk of cancer the most? Chewing tobacco, eating spicy food, using mobile phone.
So I would put it in a decreasing category. So the most is tobacco, followed by eating spicy food, followed by using the mobile phones.
Moving forward, I want to ask, this is a very important question. What should people remember if they have to take only one message from this podcast?
Only one message, then it can be that cancer is serious, but it is not hopeless.
Welcome to another heartfelt episode of Let's Talk Life, hosted by me, Dr. Chitra Shukla, your guide in clinical psychology. Today, we are thrilled to be joined by a brilliant mind in oncopathology, Dr. Dhruvi Shah, consultant pathologist at HCG Cancer Center, Vadodara. With 7 years of experience and MBBS MD in pathology and a 2-year fellowship in oncopathology from Muniseva Ashram, Goraj. A valued VAPM member, please welcome Dr. Dhruvi Shah to our family. Good evening. Welcome so much, Dr. Dhruvi Shah, to my podcast called as Let's Talk Life.
Hi Chitra, thank you for inviting me. Very happy to be here and very excited for the podcast.
Let's break few myths and true and facts about cancer, what people go through in today's show.
Sure.
Dr. Dhruvi, your passion for oncopathology lights up the fight against cancer. What's one aha moment from your fellowship that changed how you see patient stories through the microscope?
So there is no particular aha moment during my fellowship, but there is one particular thing that I want to share, that being a pathologist is very vigilant job in which you have to be very particular. Do you know there are thousands of vessels and nerves inside our tissue, and if there is entrapment of one nerve by the cancer cell, that can change the staging of patient and that can change the treatment of patient. So even a small nerve that has a diameter of less than 1 micromillimeter, that can change the stage of patient. So we have to be very particular, and that's why I would like to say that we are Sherlock Holmes of doctors, and we have to find minor pathology in otherwise normal individuals.
Correct. Going forward, ma'am, the most recent question that patients throw at me is, what is the biggest misunderstanding people have about cancer?
So the biggest misunderstanding about the cancer, I would say that every cancer leads to death. So that is the biggest myth. No, not every cancer is fatal. And with the recent advances in the treatment and medication of the cancer, there is so much life after the diagnosis of cancer.
If you don't have cancer in my family, can I be free? That is the most top question that I found on internet.
That's a tricky question. No, there is nothing called safe or danger in the cancer. So if there is no family history, definitely you are at lower risk than other individuals who have the family history. But other factors like environment, your lifestyle, your food, your habits, they all play very major role rather than just a family history.
How can someone support a friend or a family member with cancer without saying the wrong thing?
So the most major thing that is listen more, talk less. I would say don't give fake or forced positivity to that patient. They need moral support, they need emotional support, they need financial support. So give your support your way to encourage the patient rather than just saying कि भाई थई जैसे तने सारू छे. That is a pity. Don't do that.
There was one boy who asked me this question. So this is very personal question. Doctor, I'm completely fine. Why should I even worry about cancer?
See, now that is again a tricky question. So in a cancer, there are many cancers which are very silent in the beginning. So cancers don't shout, cancers don't make noise, they just whisper. So in the beginning, you may not get any symptom or any other things, but by the time you get the symptoms, it is already very advanced. So like screening is very necessary, and screening is like checking your house wiring before the short circuit happens.
So ma'am, I would also want to, could you put some more light on when you said screening? So
Right.
in a year, a person should do screening every year, and how can a person check cancer? Could you put just more light on this?
See, there are multiple screening methods for cancer. So for like breast, I would suggest that after 40 years of age, every female should do a mammography once a year. There is another test called pap smear that should also happen like after 35 years of age. Another thing that is very important is having HPV vaccination that can be given to adolescent girls from 9 years to 14 years. That can also be given. And there are other screening factors like PSA that can be done for the prostate cancer. Another markers like CA19-9, CA125 for the ovarian or the peritoneal cancers. So once a year, this parameter should be checked.
Correct, ma'am. Moving forward, I want to ask, this is a very important question. What should people remember if they have to take only one message from this podcast?
Only one message, then it can be that cancer is serious, but it is not hopeless. Awareness, screening, early detection, and medication can give lots of life and happiness beyond cancer.
Correct, ma'am. And what would you say if you have to define what is the right age that a person can have cancer?
There is no right age for the cancer. You can get cancer at any age in your life. There are many congenital cancers that can happen just after or before the birth. There are many cancer that appears at adolescent stage. Definitely age is a factor that with aging the risk of cancer increases, but there is no way that cancer cannot happen at early age.
Ma'am, could you please throw some light on early symptoms of cancer so that one person can go and do the screening?
So there are multiple symptoms for the individual cancers, but the common which we get in cancer, that is high fever, night sweats, weight loss, back pain, this long-standing back pain. This all should be screened out first rather than ignoring them.
Said that, let's play some true and false.
Sure.
Okay, so with this heavy topic, we want to, reduce the stress of the audience also.
Sure.
That if you have, people have some misunderstandings about cancer.
Right.
So I'll read out few questions for you. Please let me know, is it a myth or it is a fact?
Sure.
Every cancer is painful, myth or fact?
It's a myth. There are many cancers which are painless in the beginning, and there are also many cancers which are painless at the advanced stage. So, no, the pain is not the fact.
Every lump is a cancer.
Again, myth. There can be different reasons for the lump. The lumps can be benign, the lumps can be neoplastic. For the benign, there are multiple reasons like inflammation, infection, normal cyst, or hormonal cyst. So, the detection is necessary.
Very well said, ma'am. This is my favorite. Can cancer spread through hugging?
No, definitely not. The cancer is not contagious. Hug freely.
Biopsy spreads cancer.
Myth. Biopsy is actually one of the most accurate diagnostic modality. So that gives a diagnosis rather than spreading the cancer.
A quick quiz. Which habit increases risk of cancer the most? Chewing tobacco, eating spicy food, using mobile phone.
So I would put it in a decreasing category. So the most is tobacco, followed by eating spicy food, followed by using the mobile phones.
Can younger people get cancer?
Yes, it's a fact. Cancer can happen at any stage of life. So yes, younger patient can also have the cancer.
Are they born with these cells, or is it because of their lifestyle cancer happens?
So now this is not a short line topic. This is an elaborated answer. So for the elaboration, I would say that the factors which affect or increases the chances of cancer, that is family history, that is environment, that is your lifestyle, that is your food habits. But above this, there is one called genetic mutation. So genetic mutation can happen at any stage of life. That can happen intrauterus during the fetal life, that can happen at early age, that can happen at adolescent, or maybe in the advanced. So the mutation is more common during the advanced age, but it can also happen intrauterus.
Stress directly causes cancer. This is the most repetitive question asked to me also, knowing my field as a clinical psychologist. Please break down this in a simpler way, not just by myth or fact, but I really want my patients also to listen to this.
Stress can directly affect cancer. I don't want to go into the technical part, but there is some disturbance between chemicals and hormones that can lead to cancer. So it is like chemical locha inside your body. So cancer hoga.
Good to know, ma'am. Going forward, so these are few questions that I want you to answer, which have been researched by me personally. Does artificial sweeteners causes cancer?
No, actually there are multiple researches that have been done on the artificial sweetener. So the artificial sweetener actually in a prolonged use can cause some effect on the liver, but what type of artificial sweetener you are using and at what frequency you are using, it is more important. The natural sweeteners like stevia and monk fruit extract, they are better than the chemically made sweeteners. In any case, I would say ati sarvatra varjayet. So excess use is harmful for the body, not causing the cancer, but causing some effects on your body.
What does skin cancer look like?
Skin cancers can look like ulcers, skin cancer can look like warts, skin cancer can look like velvet leather. So depending upon the type of cancer, it can look different.
What type of radiation is used in cancer therapy?
There are n numbers of radiations that are used in cancer therapy. So like radioiodine is used for thyroid cancer, and the fraction radiation therapy that is used for the multiple cancers.
Last but not the least, how do you prevent cancer?
As we have discussed earlier, that improving your lifestyle, improving your food habits, and early screening and detection can prevent us from a cancer.
Thank you so much. That was very enlightening and educating for me as well as the audience.
I hope the podcast was eye-opener and informative for the people who wants to know more about cancer.
Thank you so much, ma'am.
Thank you.
That's all for today's enlightening chat on Let's Talk Live with me, Dr. Chitra Shukla, and our esteemed guest, Dr. Dhruvi Shah. Knowledge thrives when we gather and share. Connect with us on Instagram, YouTube, and WhatsApp for more insightful into mental health and oncology. Remember, early whispers from pathology can silence cancer's roar. Until next time, keep talking, keep sharing.